Hello there, this is Dr. Mintz. This is a young adult who was in an automobile accident, MVC, and had head injury, came to the ER, and this CT was done. There are a couple of findings here. First, you see these white dots in the hemispheres. Multiple small areas of increased attenuation would be a more proper term to use. Several high attenuation areas of abnormality in the hemispheres bilaterally, more so on the left than right, suggesting small hemorrhages. If you look closely, you'll find that many of these are at the junction of the gray and white matter. And this is a classic appearance for white matter shear injuries. It is posited that the etiology is the differential density of cortex versus white matter, and therefore there's a different deceleration for the gray matter and white matter, and therefore at the interface there is a tearing effect. And so you can look here, that's gray-white matter junction. This certainly is. This certainly is. Okay, so what is this area of hemorrhage here? This is subarachnoid hemorrhage. It is in the right Sylvian fissure. And this is a good depiction of the Sylvian fissure on an axial CT that allows you to see that this is Sylvian fissure on the left side, and you see it here, and this is a typical appearance of the Sylvian fissure. It's not just a simple crevice, it has complexity to it, and we see that over here on the right side too, although it's more clearly depicted on the left. But the depth of the Sylvian fissure is opacified with blood, subarachnoid blood, and that's what we're seeing here. And it's in the dependent aspect of the Sylvian fissure, because if we go farther forward we find that it's not filling the very anterior-most aspect of the Sylvian fissure, which is typical for a subarachnoid space. It's going to move about freely within the subarachnoid space. A follow-up CT was done a few hours later, and we see right here that one of the hemorrhages has obviously increased. These three have increased as well. The subarachnoid blood, which we saw so clearly earlier in the Sylvian fissure on the right, has dissipated, and you only see now a very little bit in the dependent aspect of the right Sylvian fissure, and you can see a little bit now in the dependent aspect of the left Sylvian fissure. This shows you how far back the Sylvian fissure goes. The little bit that we saw in the lateral ventricle has dissipated, but some of it has gone into the ventricle. This little tiny high attenuation area in the dependent aspect of the occipital horn of the left lateral ventricle is in fact a very tiny amount of subarachnoid hemorrhage. So we don't see this too often, but it's a classic appearance of white matter shear injury, usually occurring at the gray-white matter differential point, the plane between the gray matter and white matter, due to the differential density of the gray and white matter and the resultant shear forces that occur with deceleration.